Good evening, everyone. I'm Caroline. I'm the general manager of Cove, and we're here today with Dr. Sara Crystal. Sara is a neurologist at the New York Headache Center, as well as Cove's medical director and a migraine sufferer herself. We're super excited to do this Facebook Live with all of you. And today we're answering your questions about best things to do during a migraine. I think there are plenty of answers to this and also plenty of questions that you've already submitted. So thank you for that. Before we jump in, I want to remind everyone again that we can't answer your personal migraine diagnosis or questions, but as long as you keep the questions general and non-personal, we can answer all of those, and we'll try to get to as many of your questions as we can. And I want to also thank everyone here who has already messaged us, already chimed in with our questions. Please keep them coming, and we were really excited to see so many questions come in. And with that, I think we're ready to start. So welcome, Sara. We're so happy to have you.
Thank you so much for having me, and thank you everyone for joining.
Great. So what I thought we'll do is almost like a warm-up as we talk about best things to do during a migraine. Let's start with a fairly general question. How do I know if my migraine headache are migraine or just regular headaches?
So that's a really good question. A lot of people ask. Some features that distinguish migraine from regular headaches are that they're typically one-sided, they're throbbing, they worsen with routine activities like going up and down stairs or running, and they're often accompanied by light or sound sensitivity or nausea and vomiting. A good rule of thumb is that if you've had a headache with light sensitivity or nausea that's interfered with your activity in the last 3 months, you likely have migraine. And keep in mind, migraine is often very common and often undiagnosed, and almost 20% of women in this country have migraine, 6% of men, so quite common.
And so why do you think that is, that so many migraines go undiagnosed?
Well, I think it has to do a lot with people not recognizing the unique features of migraine, and also people just thinking that it's sort of normal. They say everybody gets headaches. They don't realize, that migraine is sort of a distinct entity.
And so what causes migraine? I feel like we hear that all the time from our patients, like, why do I have migraine? What is the cause of my migraine?
So the cause is your genes. So, you definitely blame your parents and grandparents. That's the cause. As far as triggers, triggers are what decrease your threshold to having, specific attacks. And those vary so much from person to person. Some of the common ones are hormone changes, weather changes is very common. Dietary triggers are common. And I can go into those a little bit more because those are important. Stress, stress doesn't cause migraine, but it can trigger or lower your threshold for having an attack. Changes in your sleep cycle. So keeping a regular sleep schedule is really important. Going to sleep, waking up at the same time every day is important.
So when you were saying that, I always think, and obviously, we come across triggers for migraine all the time in my day-to-day. I always think, wow, life is basically a trigger for migraine, right? It's like, it's everything. It's food, it's sleep, too much sleep, too little sleep, stress. And, especially in 2020, who doesn't experience stress? What do you tell your patients on Cove and in your headache clinic? What do you tell them about, like, what are the top 3 things to do to avoid triggers, or really, avoid triggers, and with that, manage their migraine better?
Yeah, that's a really good question. So the first thing about triggers is identifying what your own triggers are, because they vary so much from person to person. And the best place to start is with a headache diary. It's annoying, I know, but really tracking your headaches and writing down what triggers you might have been exposed to really helps establish that relationship. And for women, tracking your periods as well to see if there is a relationship. And then when it comes to triggers, often it's a perfect storm of triggers that can cause an attack. So in other words, you may be okay occasionally having a glass of wine, but don't do it when you're about to get your period, or you have some other triggers going on, or the weather. If the weather's a trigger for you, then you want to be especially careful then. So some things you can't control, but you can avoid piling on triggers, which may push you to the headache.
Great. And tell me a little bit more about the cycle and migraines. I feel like we talk a lot about menstrual migraines, but how is menstrual migraine different from, normal general migraine?
Yeah, so the thing about menstrual migraine is that they can be more difficult to treat. They're often more severe and longer lasting. So often women find that whatever works for them the rest of the month doesn't work as well for their menstrual migraine. Menstrual migraine is very common. So about 60% of women with migraine will see a connection between their periods and their headaches. And maybe about 15% of women have just migraines exclusively around their periods. So again, tracking it and finding exactly when in your cycle, because we define it as anywhere from like 3 days before or 2 days before and 3 days into your cycle, as by strict definition is how we define menstrual migraine, but can vary from person to person. So tracking it can help, because sometimes taking long-acting anti-inflammatory preemptively can help prevent menstrual migraine.
Interesting. So you would say take an ibuprofen or something like that 24, 48 hours before the period starts.
Yes.
As a way to almost prevent the full-blown migraine attack happening.
Yes, exactly. Basically getting at least a day ahead of whenever you expect the headache to be, and a long-acting anti-inflammatory, like something like naproxen, works longer than ibuprofen would be especially helpful.
And so in Cove's experience, the vast majority of people definitely start by treating their migraine with over-the-counter medications. But I assume that, when you see patients in your headache clinic, and also when you treat patients on Cove, typically they have, passed that stage of over-the-counter medications. How do you think about when over-the-counter meds just don't work? How do you think about looking at those patients and determining what the right thing is for that patient?
Yeah, so good question. Everyone that I see, basically, I feel deserves a migraine-specific acute treatment, because clearly, when they're seeing me, they don't need me to tell them to take an over-the-counter medication. So our migraine-specific medications are the triptans. These are, decades old. They were developed specifically for treating migraine attacks. And then we also have some newer medications acute medications that address CGRP, which is a protein that's widely distributed throughout the body, but is elevated during migraine attacks. For patients that have nausea, significant nausea with their headaches, sometimes the migraine-specific treatments don't help with that, sometimes can even exacerbate that symptom. So I recommend a separate nausea medication often.
And then you mentioned the preventive medications. What are some good rules of thumb you use to determine whether someone should be thinking, not necessarily taking a preventive medication that they take every day, but how do you think about the good rule of thumb on when is the right time to actually have a conversation with your doctor about, should I be taking something every day that doesn't just treat a migraine attack, but mostly prevents a migraine attack from happening? How do you think about that?
Sure. So basically, if someone has 4 or more days of headache a month, that's when we start thinking of preventive. And you should really strongly consider it if you find that you're taking your acute migraine medications more than 2 days a week.
Got it. That's a really good rule of thumb. And I assume your other comment refers to, the risk of, if you take too many of the acute medications, you can have something like medication overuse headaches. So yes. Tell us a little bit more about that.
Yeah, so medication overuse headache refers to the phenomenon that when you take more acute medications, you actually get more rebound headaches. So it's the concept's a little has been, rethought in the last couple of years as to what medications actually cause it. I think that most everyone will agree that opiate containing medications can cause it. The caffeine containing medications, like even though over the counter ones, can contribute to it. And our general, whether or not triptans do, that's, many people think they don't, but the general rule of thumb is that we try to avoid taking acute medications on a regular basis more than 2 days a week. That's when you can get into trouble. And so, when you think about, sometimes it's a little bit of a hard sell to when you talk about preventives, because people don't want to take a medication every day. But when you kind of point out that, well, you're taking a medication, but you're taking something acutely, many days a month, then they, that kind of reframes it.
Got it. Another thing I'm curious about, what we hear is not just I don't want to take a medication every day, but are there natural remedies? Are there things that I can do to manage my migraine that are not over-the-counter drugs, that's not prescription medication? What else can I do? We talked about lifestyle changes a little bit already, but are there some natural remedies that you would recommend?
Sure. So for prevention, there are several supplements that have good evidence that they help prevent migraine. Magnesium probably has the best evidence that it's helpful for migraine prevention. We recommend around 400 milligrams a day. Another supplement that has good evidence is coenzyme Q10 or CoQ10, which is an antioxidant. And a third one is riboflavin or B2. So taken in combination, they may be especially effective, and that is a lot of pills. We actually offer a supplement called Beam, which is all those supplements together in a powder form that you take daily. So it's pretty convenient. But sometimes that's a hard sell, or just remembering to take lots of different vitamins a day can be tough.
Yeah, I mean, we worked on Beam, and I obviously worked very closely with the whole Cove team to develop Beam, but I think what we saw as a compelling value proposition was that you don't have to take more pills, right? It's one powder stick pack. It has everything you need in one dose. And something that we hear over and over is, I just don't want to take more pills.
Exactly.
We get the question about Beam. If anyone who's watching has checked it out, we get the question a lot of why did you not make it one pill? Well, because actually, if we wanted to get everything that's in Beam into one pill, it would be 4 or 5 pills. That's why it's a stick pack, because no one wants to take 5 pills a day in addition to what they're typically already taking. And that, for many of our patients, it's birth control first and foremost, and then it's also migraine medication. So that's a little bit of the story about Beam. We have a question here about weather and weather as a trigger. As I look outside today in New York, it's been pouring rain all day, and I think it's been already pouring most of the days this week. So talk to us about the weather and migraine.
Yeah, so that's a very, very common trigger that people report. And weather changes, encompass so many things. It could be, rainy weather, changes in barometric pressure. People often report, of course, heat, sun, all those kind of encompass some of the triggers that people report. And yes, of course, you can't do anything about the weather, unfortunately. But you can, again, try to manage your other triggers around, when you know that the weather is going to be bad for you. And, another thing I recommend is actually, here's, the tracking again. You can look, one app that I find helpful is WeatherX, which, alerts you to weather changes. And when you get these alerts, you can, take something preemptively to prevent a full-blown weather-related attack. So the first step, again, is, tracking, diary, all that.
Yeah. And just a quick reminder to everyone here who's submitting questions, please don't submit personal migraine questions that relate to, your personal medical history. Try to keep them general, because we're just not allowed to answer personal questions that would count as medical advice, which we're just not allowed to give on a Facebook live. That's why there are Facebook Lives, and there are doctors who will then look at individual concerns. Let's talk a little bit about migraine and work. Someone asked us a question around, what do I do when I get a migraine when I'm at work? What can I do about it?
Okay, so if you're unfortunately actually at work and not at home, you can try to find a dark, quiet place. Of course, take your medications, and then let someone know at work, what's going on. But first off, take your medications and try to just eliminate any environmental triggers.
Got it. We had we have a question here from Susan around migraine and menopause, and explaining the transition from having migraines maybe start during perimenopause, but then stopping or being more unpredictable during once menopause has happened. What do you advise women who are at that stage around migraine and also managing the predictability of migraine? I feel like a lot of our patients, they kind of know the deal. They know when a migraine arrives, especially when it's menstrual migraine. They have their rescue medication at hand, which is really quite critical. But what do you advise women to do when the pattern just becomes less predictable, and also hormonal changes just change probably the type of migraine?
Yeah, so the perimenopause is often a really tough time for women. I mean, the good news is that when you're in full-blown menopause, probably 2/3 of women, their headaches will improve significantly or totally resolve. But getting to that point, and the perimenopause can last, a year or more even. And I sometimes see women that have experienced migraines for the first time in their life then. So I try, if the headaches are frequent enough, then I definitely recommend a preventive. And it's probably not a lifelong thing by any means, but to get them until they get to full-blown menopause, preventives, and of course acute medications can be helpful.
And we have the question around, what are your thoughts on hormone pellets? I admit I'm not familiar with that, but what are your thoughts on hormone pellets to manage migraine during perimenopause?
I mean, hormones are tricky. Manipulating with hormones is always tricky. I mean, I just always recommend speaking with your GYN. Sometimes hormone replacement can be helpful for perimenopausal women with migraine, but of course you have to discuss the risks versus benefits. Generally, for women that have migraine with aura, the risks are even higher, so those might be avoided.
Yep. I have a few specific questions I want to get to that some of our audience submitted prior to this. Could my contact lenses be causing migraine?
Yeah, I think that's very possible. So people with migraine have something called allodynia, which is just overall sensitivity, whereas in another person, a certain stimulus might not be painful. It's painful for people with migraine, and some people with migraine can't wear glasses, can't pull their hair back, and contact lenses wearing is also often a problem too. I just spoke with a patient today, and she said now that she started preventive, she no longer experiences that. So it is common, but it definitely make sure that you have the right prescription and that it's like the right curvature for your lens. Because if it's a little bit off, another person may not feel it, but a migraine patient would.
Another question we got was, how can you tell the difference between a migraine and a brain aneurysm?
Okay, so that's a really good question. And obviously, aneurysms are very serious, but the typical headache experience with an aneurysm is what's called thunderclap, and it sounds like just like what it sounds like. People describe it like being hit with a baseball bat in their head. It's just like a sudden abrupt pain, and if you get that type of pain ever, you should definitely seek emergency care. Whereas migraine, typically is a little bit more gradual.
Yeah, tell us maybe a little bit more about how there's nothing such a typical migraine, but how most migraines, start.
Yeah, so many people experience this is what's different about migraine and other, just plain old tension headaches. It's kind of a whole brain party going on. So there's the prodrome phase, and that can start even up to a day or more before people describe mood changes, appetite changes, before the pain even starts. And then the migraine phase itself, for most people, the pain, I mean, it could build up within minutes, but like not seconds typically, or over hours. And then the migraine phase includes the other symptoms: the light sensitivity, the sound sensitivity, nausea, vomiting. And then even after the migraine resolves, some people have this postdrome, which for the next day they feel, or more, feel tired, or sometimes even euphoric. It can go anywhere with migraine.
And when you feel like, one question we got was, when someone feels that a migraine attack is coming on, do you recommend drinking a lot of water? Does hydration still help at that point?
So it's probably not going to stop you from going into a full-blown attack, but it'll help you absorb your medications faster. And certainly, avoiding dehydration, of course, is important for preventing migraine.
And let's assume someone has a migraine, and what we hear a lot from our patients is some migraines are just hard to break, right? So what do you recommend to patients when they've had a migraine for 2, 3, 4 days and just can't break the migraine and, get back to normal?
Yeah. So we call that status migrainosis, when a migraine goes on for 72 hours or more, and that's really tough to treat. I will say, if you have unstoppable nausea or vomiting, you might have to go get IV fluids, possibly, if you can't keep things down. But this is where you kind of pull out all the stops, treat all your symptoms. You take obviously take your migraine specific medications, treat your nausea, cold, if that's helpful for you, whatever other non-medication remedies are helpful for you. People that tell me they have a history of going to an ER for a headache, I usually like them to have like a non-oral form of a migraine medication, sometimes an injectable or a nasal spray, because at that point, oral medications just aren't being absorbed so well.
Yep, that makes sense. We have a question here from Susanna. Let me just pull it up again. Can you talk about low blood pressure and migraine?
So I wouldn't say low blood pressure causes migraine per se. I mean, many women with migraine happen to have sort of baseline low blood pressure, and it does make things tricky because some of the medications that we use do lower blood pressure. I'm not sure specifically what else.
You don't typically see a correlation, or it's not like low blood pressure causes migraine or is a factor.
Not like a causality, but there does seem to be some connection.
Got it. And some of the preventive medications, as you alluded to, are blood pressure medications, right? That happen to also reduce the frequency of migraine. So I assume, and typically you can't use those in patients who already have a low blood pressure baseline.
Right.
Got it. That makes sense. So another question we get a lot is coffee and migraine. And, I always joke, is like, too little is not the right, too much is also not right. So is there a golden rule around coffee and migraine?
Right. So, caffeine is definitely a double-edged sword. So, it helps acutely, during an attack, because it constricts blood vessels in the brain, around the brain temporarily. But too much caffeine on a regular basis can definitely contribute to rebound headache. And our general rule of thumb is, more than 2 cups of coffee on a regular basis can be a problem.
Got it. And tell me a little bit about how you manage when someone is planning to get pregnant, and what can someone who's trying to conceive expect to happen with pregnancy and migraine. And, I've definitely, when I read some of the migraine groups, and we've definitely heard it for patients, there's a whole lot of anxiety around changing basically anything in your life because it might change your migraine pattern. What do you tell patients who are trying to conceive and what to expect about pregnancy and migraine?
Sure. So as far as what to expect, for some women, a lot of women, I would say probably 2/3 of women with migraine improve during pregnancy. For some people, it's literally the best time of their lives. They say, I wish I could be pregnant all the time. And that really applies more to the second and third trimesters. The first trimester is often dicey because of the wide fluctuations in hormones. But in general, it's a good time for the majority of women. But then again, then there's that percentage that don't do well and even do worse. In terms of planning for pregnancy, so the majority of medications, the preventative medications, we try to avoid in pregnancy. There are some exceptions that can be used during pregnancy, particularly, or can be continued in pregnancy, particularly if someone was on them before. But this is when you actually have time to plan, this is the time to really explore non-medication options. So biofeedback, acupuncture, all of those any stress reduction type of techniques that you can learn can be very helpful.
So you just mentioned non-drug interventions such as biofeedback. I'm pretty sure not everyone here knows what biofeedback means. Can you talk a little bit about what that is and what that can look like?
Sure. So, when we go through, our body goes through stress, whether it's a physical stress or a mental stress, our bodies really don't distinguish between the two. We go through this, fight or flight response, which is a sympathetic storm. And with biofeedback, you learn to actually modulate your body's response to stress. It's a little bit time consuming to learn. But there are definitely techniques you can learn on your own, but it's typically learned with a one-on-one with a practitioner. But it's just a great way of learning how to modulate your body's response to stress.
And would you say some of the devices that I'm sure some of our audience here has come across, they use these biofeedback mechanisms?
Yes, there are devices that use it. Yes.
Got it. That makes sense. So maybe we can talk about some other lifestyle hacks that you recommend. What are the things, when someone comes to you for seeing a headache specialist for the very first time, what are the top 3 lifestyle modifications that you recommend to someone?
So I would say sleep. Working on your sleep. So getting enough sleep and just keeping a regular sleep schedule. For example, people, you like to sleep in on the weekends. For some people, that's a trigger. Just sleeping in even, more than an hour late can trigger a headache. So really just trying to keep a set schedule. Stress reduction, very important. Aerobic exercise is very important. And then familiarizing people with the common food triggers. So I don't recommend a specific migraine diet. I do recommend familiarizing yourself with some of the common food triggers. And these include foods that are high in nitrates, like deli meats, sulfites, like red wine, and then foods that are high in tyramine. The National Headache Foundation actually has a great list of high tyramine foods, but basically these are pickled foods, aged foods, even overripe fruit is high in tyramine.
Oh, wow. Yeah, I would not have guessed that. And when you say aerobic exercise, is that, I need to do exercise an hour a day, 30 minutes a day, a few times a week? What type of rule of thumb do you give people?
I think 30 minutes a day, like at least 3 days a week is a good rule of thumb.
Got it. That makes sense. Let me check if there's some more questions from our audience. Please feel free to ask away. Actually, let's talk about home remedies. Are there any, home remedies that you recommend to your patients in addition to some of the lifestyle hacks?
Sure. So applying cold packs. There's all sorts of things you can get. There's all sorts of cold wraps you can get. Although some people swear by heat, I would say like a smaller percentage of people. Um, some essential oils, applying them, to your temples. Particularly lavender has been shown to be effective. For nausea, ginger supplements or ginger candies can be helpful.
Got it. And what's so you spoke about sleep and migraine. It sounds like from what you're saying, too little sleep is typically a trigger, but like what is what are the patterns that you see around sleep and migraine?
So definitely too little sleep. And in general, most people need around, at least 7 hours of sleep. Um, a lot of people have insomnia, and that's an issue, especially and anxiety of course contributes to that. There are good programs that are helpful, apps like there's one called Shut Eye, another called Calm, Headspace. These are all programs that you can try before bed. They're very calming and soothing, and they can help with insomnia.
Got
So
it.
addressing insomnia is important.
And so maybe, one last question as we wrap. 2020 is a stressful year. What do you recommend your patients, between COVID, the overall political climate we've been living in, the upcoming election? There are lots of stressful things happening in everyone's lives right now, and everyone lives through them differently. What do you recommend to your patients in terms of managing stress when there are so many things that right now feel so beyond our control? I can manage a stressful job maybe, or try to figure out how to control stress in my personal life better, but what do you say to your patients in terms of managing stress that comes, from all of these external factors, especially this year?
Sure. I think just identifying what works for you, your outlet, whether it is exercise, whether it is time to yourself, and just being, very, making it a part of your schedule, really.
Mm-hmm. Yeah, tricky, but
Yeah.
it's tricky, and migraine is certainly not a simple condition to treat. That's definitely what we see at Cove every day. I want to thank everyone here today for joining. Thank you, Dr. Crystal, for joining us. This was incredibly helpful, and hopefully many of you will have found this helpful and informative. Thank you again for all of your questions. We truly appreciate it. And I'm sure we'll see all of each other soon again with a new topic. Thanks, everyone. Have a good evening,
Thank
everyone.
you.
Thank you, Sarah.
Good night.